that time don't give more pressure. Okay, just give him little bit, allow to lift. Yeah, go slowly. Go. Yeah, now try to give little pressure. Now go, try to go touch there.
Bend your knee and touch it to the.
Is penny?
It's very difficult to like push.
Okay. Okay. Once again, please. Okay. Now, after this is very difficult, means there is more stiffening in your psoas.
Yes.
Because when he's coming here and he loses the whole pressure. Okay? When he come here, he loses the pressure because after the 90 degree, now this is the iliopsoas. From the here to till here, this is the most psoas measure. After these minor flexions, okay, that is for your iliopsoas. Okay? Now try to do this one.
Better.
The left one is little better, but still there is mild. Okay, so for iliopsoas, what we'll do, if you try to do like this, okay, this is the proper like stretching for your iliopsoas. Okay, and this is the contractions of the iliopsoas. When you're doing like this, do you feel anything? Nothing major, right? Maximum time what happen when the patient is flexing the hip like the right one, okay, and they are trying to create the pressure from the left side.
Oh.
Okay, they are using this part more. They will lift their part like this. Okay, that is also sign of the weakness. And the maximum time of pressure will go on the opposite side. When they're lifting this, and they will feel the pressure on the opposite side. Okay?
So his left side of the back is
Yeah.
sore.
Once again, please. Yeah, there is something in the iliopsoas. Okay, one more time.
This better.
Okay, the left one is little better. So how will check the iliopsoas? Okay, relax. Now do like this and turn like this. Now your hip is open.
Yeah, sorry. Please.
Okay. And now we'll go here. So this is the point. This is the your iliopsoas. This is the your iliac bone, and this is the iliopsoas. Okay. And if some people having the like more stiffness, then try to relax the body. Okay, now relax your body. He's holding body very tight. Okay, so difficult to push. Okay. Okay. This one is iliopsoas. Touch here. You can touch from this side. Okay. Inside the iliac bone, like this. Yeah.
This is
Yeah,
the
this is the iliopsoas. Sometimes when you're pressing a little bit, no, you feel lots of pain, like pain is radiating in the groin area too much. Okay? Yeah.
If he
So,
lifts
so
up
yeah,
his knee,
this is the
it
iliac
pops
bone. Go next to iliac bone and try to go inside like this one. You feel the mild stiffness. Yeah, this side.
Oh, sorry.
Yeah, that was the exactly.
Relax.
Yeah.
Okay? Yeah.
You are the
Like
model
this.
today.
This one. This is the iliopsoas.
You feel pain.
It is strong.
Left side
muscle, it
more.
doesn't feel weak.
This side.
This side
Yeah,
touching.
left side is
It feels
too
stiff.
much.
This side is too much.
Yeah, it's I can't bear it. Push too
So
much.
maybe this is the weak because he is not able to lift, and that is the stiff.
Yeah, there's a stiffness
is too.
Okay, this is the muscle.
Okay. So this is just for your iliopsoas. Now try to lie down on here. You can check everything.
Yeah, it's pretty stiff.
Check that side.
Yeah, this one is more relaxed.
Oh yeah, very easily we can.
Yeah.
I want to see that then.
Okay, so if for example in this muscle, if you are checking from the hair, no, then check this muscle here only. If you go a little bit more deep down, that is different. Exactly on the same. For example, here I am checking in this area. Check this one. So this one is more stiff. This one is little bit more relaxed. Yeah.
So in fat people, we are not able to see.
So this you can see.
Yeah.
Yeah. Fat iliac bone, there is no fat. Okay. If some people having the more belly, you can lift the belly like this and put your hand down.
But it will be
There are two
painful.
Hold
patients. I
your
used to do
belly.
that.
Wow.
Then after inserting needle, when you lift the belly, you couldn't find the needle. Where is needle?
But that doesn't hurt them? Like,
No, we'll insert a little bit of the whole.
This tip.
So needle is like perpendicular, and if you're touching, that will hurt. It is like this. If you're touching, the needle will bend. That will not hurt.
And when we touched the fat one, we had touched there inside, they get pain too. They don't allow us to do get deeper.
As per me, what I find, never ever try to give pressure pain to patients. This is the diagnosis. Within the diagnosis, you are giving the pressure to just feel. Oh, is this paining? I don't think. Just give the very soft. They will. You can see the difference when you are touching like this. No, you have to just find there is a stiffness or weakness. Doesn't matter the patient is feeling the pain or not. What we are doing the diagnosis. Okay, so I can feel the very easily difference between this and this. Okay, because sometimes when you press a little bit deep, of course everyone is feeling the pain. So okay. Lie on your stomach, you know. So I was talking, when that muscle is more stiff, this part will go more deep, and this will be more. It will come little bit more up like this. The side muscle will come little bit more up like this. Okay, but from the here we can't touch the psoas major. There is no way to touch the psoas.
More developed.
This side is more developed, right? The left side was more pain.
Yeah.
So sometimes when the psoas major becomes steep, no, the psoas major is pressing your upper muscles, then upper muscles come little bit more on the top.
yeah, we can see clear. Like,
Yeah.
yes, it's really elevated.
We had one magic on some previous course. He was here, so he was not able to like flex properly like this, and we did 2-3 needling. I just thought that was my first time. I did 2-3 needling, and he came like this, and he was like this. Oh, I am able to touch the floor. It's sudden level because the muscle is released. Okay, so sometimes it's happened because of this top muscles, the longest thoracic.
And why are you saying you can't get at the psoas major here?
Because
now?
the psoas major in the fourth layer, these muscles. For example, this is the muscles layer, latissimus dorsi, longissimus thoracic, and QL, and this is psoas major.
Yeah.
So if you're going from here, how will you touch this finger?
Well, weren't you saying to access it from the back? Can you do to
No,
other
that
people?
is that is needling.
Needling.
Oh, right.
Yeah.
Oh,
You can't
right.
see
Okay.
physically.
Yeah. Oh, yeah. I know. Yeah. Yeah. Oh, yeah. I
Inside
thought he
physically
was
you
saying he
feel
can't do the needles.
it. No, the needling, yeah.
It's on the fourth layer.
So we have to
Yeah.
go deep. That's why 75 hours. For him, maybe 60.
We have the what's here and there.
The dents.
Yeah.
Yeah.
Okay.
Why do people have these actually?
Then
It's normal.
So, if the spine goes in, very much in, then what
The
happens?
smallest tips in psoas major. Okay.
more stiffness.
So, does the stiffness go on the heel then? People feel the pain on the heel?
Yeah. When this muscle are more stiff, there is stiffness in heel also. You can see the practical his case. His lower back muscle are little stiff, so he always walk like this.
And people who have big belly also, because of that also stiffness comes, no? You just get it.
Then you're building.
That is the upper muscles. There are 4 layers of the muscles, no? Now we are talking about the last one, which is psoas major. When we'll come on the trunk extension, so these top muscles, these are the holding your body like this. Belly is pushing more on front, and this muscle are holding like on the back.
So
It's when you're pregnant, you
Yeah.
lean.
Right.
Some people stand like this.
Yeah. So because of that also you get this thing, no? Like
Curve.
the
It's
curve.
that's the normal.
No,
because of
when
course
it
your
goes
body-
too deep.
Yeah, but body is holding you from the inside. Inside, and your muscle is going like this, and of course your spine will go in more deep.
In this case, like if they have big belly, your psoas muscle is getting more stretch, right?
Okay, so now mostly what we do sometimes just see where is the more curve, like going spine more deep. We'll target on that area.
So that is
Because that part is more, steep. The filament is more steep.
I
So
can see
we'll,
the color there. Yeah, it's a little lighter.
yeah. So we'll go here, and this is the top of the spinous process. Okay, this is the top of the spinous process. Okay. 1.5 tune. Okay, and try to go more straight. Yeah, the superficial muscle also steep, so that time patient feel the more pain. If the muscle top 3 muscle are steep, then each and every muscle will pain. Because when we go here, this is steep. Here is steep. This one is steep. So we are crossing like 3 steep muscles.
And you go slow or you will keep time
No,
in
you
each
keep
layer?
You can release the mild top muscles,
Uh-huh.
then go a little bit more deep. See, now the needle is mild bend, so I touch the bone. You can feel how you feel when you touch the bone.
So, which bone you touch?
Yeah, this transverse process, this one.
Oh, you touch that bone? Oh, but I feel like the needle is
very
getting
deep in.
really more deep.
No, if you see the spinous process only this, but transverse process size is very big.
Yeah.
Oh yeah.
Okay, so 1.5 tune. See,
You can feel the bone?
But you don't want to touch that.
No, I want to cross between these two.
Sense, eh?
Then we'll reach. If you are crossing these two, then you will reach this psoas major.
Okay, so from the tip,
Yeah, we'll go 1.5 tune.
yeah.
Okay, then we'll go like this. So in real anatomy, the tip is between these two.
Okay. Right.
In the real physical human real anatomy, the tip of the spinous process
Yeah,
is between the
okay.
two transverse process.
So you've
This is
defined
artificial, no? So not
Yeah, it's not precise.
We are not hurting when we are taking a 75 needle or a 100 needle. We are not affecting any of the internal.
No. It's very difficult to cross the full psoas major
Oh.
muscle because then you reach mid of the, no, it will give you more pain.
unresisting that bone.
Can you see?
Yeah, there's
So
nothing.
you need to feel for where the
So after reaching
transverse
that,
process is, and then
But sometimes what
directly
happens?
opposite
Sometimes the mild curve is changed.
that. Oh, right.
Okay.
So you might hit.
Yeah.
the-
So this is the accurate diagnosis. Like when we go 1.5 tune side away from the spinous process.
Yeah.
But sometimes the curve is mild change.
Yeah.
When changing, then they also change.
Yes,
They will
you might
mild
hit down.
So in that conditions, what we'll do? If muscle are very stiff, then take out this needle and insert. That is like little bit irritating. Just use one more needle to next to that.
Or leave it as is.
Yeah. Okay.
Oh, like just right up.
Yeah.
or
So
underneath.
if the touching here, then we'll go mild up. Okay, relax your body.
Oh, that's a good thing we learned. We would never have figured out that bone. You can reach that.
Penny. Oh, this muscle is very stiff. Your needle is bending, not going inside.
Relax.
Sorry.
See how
Is this the.
it's now
Relax.
relaxing.
You relax your body. Relax.
This is relaxed, huh?
I'm relaxed.
Okay. Yeah. Thank you. Now, see, this is I am touching the psoas major, just try to press little bit. The muscle is very hard.
And see
Can you
how
feel
the
that?
the fascia gets up, like very contract, like the fascia gets all around the middle.
So this dent,
Yeah.
it is by birth
normal.
or because
That's normal, mostly happen with everyone. That is the gap between the iliopsoas and longissimus thoracic.
Is the difference?
That
No
is
difference is there. Just
The needle is going
It's
inside.
feeling-
If you press,
yeah.
the needle will go inside.
It's little
Very steep. For example, now this is the needle, no? See, the needle is going inside. The needle is inside now.
We need more.
More inside now.
In the psoas
Almost
major.
inside. But this is very, the needle is still going inside. Now I am the fully inside. Okay. If the bone, then
You can't go.
you can't go more deep. This needle going inside. But when you cross the three muscle, that was not that much steep. But when you touch the psoas major, it's become very steep. Understand?
Yeah, there's a big difference.
We do it to both, are you saying? Like if they have tight psoas major, you hit the bone and you hit the
No, no,
psoas
no.
major?
No, only
just
just a
psoas
If by
major.
mistake you hit the bone,
Okay.
okay, then leave it, because when you will remove, try another, then
Okay.
best things, for example,
Or
if
you
it-
just wanted to show us
Yeah.
to feel the bone?
yeah, so if you touch the bone, then take out little bit more up, now you are targeting another muscles. So you can use the both needle for the electro, one for the psoas and one for the upper muscles.
Okay.
Right? So when you will give the electro to this needle, no,
Yeah.
they patient will
this is-
start to lift, moving their leg like
So
down,
this
down.
is in between two vertebrae here.
No, on the top of the vertebral column. Here.
It should be aligned with this.
Okay.
Because this alignment is between these.
Oh,
But
yes.
some patients
exactly.
mind element change. So as per that we have to go little bit up down up down.
Okay.
But one chun.
Yeah, one chun, 1.5 chun.
One and a half chun.
So where you feel the bone. Okay.
Yeah. Some people are very skinny. Their muscle is contract more like this. Okay. So his skin is a little bit more contract. So okay. So when I will give the electro, no, his the leg will start to shaking like this. Tongue vibrating. So do not give too much electro. Just give the mild stimulations. Okay. Leg is doesn't matter if it's hurting or not hurting, but there's too much of the movement. That's not good. Always give the mild stimulations.
Why will the legs start moving?
was your
Because this muscle is attached with your femur bone.
Oh, right.
When you're giving electric, then they're moving the femur bone.
Okay.
Right? And if some muscle are steep muscles, by mistake your needle is not reached till that point.
Yeah.
If you're taking the out needle, do not use that same needle. Because this needle sharpness is more important.
So it
Okay.
will hurt when you.
Yeah, that will hurt too much. Okay, so throw that needle and use the fresh needle, that will not hurt that much. Because the long needle, we need the more grip properly. The short needle, 40 size you can use many times.
Yeah.
25 size you can use many times. Because the long needle, we use the grip from the here. The second muscle are very steep and that needle is not that much sharp. So you have to give the more pressure and there is no sharpness, the patient feel the more hurting.
Since you insert the needles, he is contracting
This.
the hamstring.
Because of
Even
neuroconnect-
though you
No,
didn't
his
apply
hamstring is
electro,
casually normally very stiff.
like this.
Yeah.
Wow.
So his is stiff or everybody's?
Everybody. So.
Not
This,
everybody.
this is what. This is what.
Checking. I'm supposed to have unbending. I can't bend.
What? Like?
You know, when
In
you're
spite of
putting
years
in
of yoga,
the
nothing
needle,
happens.
you bend it, you know, and you shove it in. When you put in the
Yeah, mostly
needle.
I do like this.
Okay.
Okay, so this needle will not bend. I'll do like this to hold the proper grip. If we are holding it straight, then it will go like this. So when I bend like this, then I have the proper grip.
Okay.
Yeah, you can apply strength, I guess. Because otherwise,